Hello, my name is Shoshana Weinberg and I am the Director of Public Policy at YouthCare, and I'm going to talk about our first policy priority, which is making Washington State a safe harbor for trafficked youth. So to understand what we mean by safe harbor, we have to start with federal legislation that passed 20 years ago called the Trafficking Victims Protection Act, TVPA. And the TVPA defined for the first time human trafficking and aimed to prevent it. And it also included a definition for a severe form of trafficking, which constituted a commercial sex act induced by force, fraud, or coercion, or performed on someone under the age of 18. So young people under 18 who performed a commercial sex act were victims of sex trafficking. But the TVPA didn't go far enough. And so even though it defined minors as victims of sex trafficking, it left the door open for them to still be criminally prosecuted for the crime of prostitution. And so it rested on the states to reconcile this contradiction by passing what is known as safe harbor legislation, which exempts minors from prosecution of prostitution and provides specialized services instead. As of 2019, there's 31 states, including DC, that have passed safe harbor legislation in the country, but Washington, unfortunately, is not one of those states. So this is the third year we've advocated to make Washington a safe harbor by passing legislation to exempt minors from arrest and charges of prostitution and provide therapeutic services as an alternative. So that's what this bill would do. It would also create liaisons in the Department of Children and Families so that they could work with young people who are involved with child welfare who are being sexually exploited, because we know that one of the highest risk factors for sexual exploitation is involvement in the child welfare system. So we hope you will join us in advocating for Washington to be the 32nd state with safe harbor legislation, and please make sure to sign up for our advocacy alerts on our website. Thanks.